Good morning, everybody. My name is Maggie Pierce, and this is my PowerPoint presentation for the Healthcare Bill HR 2581. This is Nursing 621 at the University of Hartford. HR 2581 is a bill for nurse staffing standards for Hospital Patient Safety and Quality Care Act of 2019. This is a little bit about some of the legislation history. So originally this bill was introduced as HR 2392 by Janice Schakowsky, but it was not enacted. She reintroduced this bill to Congress on May 8, 2019 as a new bill titled HR 2581. And recently in September, the bill was introduced for consideration by committee before possibly being sent to the House or Senate. After it passes the House or the Senate, hopefully it will go to the President and be signed into law. Summary of Bill's key points. According to GovTrackUS.com. According to GovTrack.com, the bill HR 2581 is a bill that will mandate specific nurse-to-patient ratios on all specialty units in the hospital. These ratios will take into consideration acuity on the units, admissions, and discharges. According to GovTrack, the bill also has a focus on the competency level to which the nurse must demonstrate education and training to ensure delivery of safe quality care. They will also consider a nurse's experience and ensure she is specialized and trained to care for that specific patient population. It's also presumed under this bill that nurses are responsible for providing safe patient care. Nurses may refuse an assignment if they believe the assignment is not safe, or if there's a patient on their assignment that they feel they do not have specialized education and training and they are not capable of taking care of that patient. There is a number provided for a nurse to be able to call at any time and voice their concerns or refuse to take an assignment. The hospital is not to discriminate against the employee for any complaints made. This ensures quality and safety patient care at all times, and it gives the nurse a voice to voice her concerns. We all know at times when there have been sick calls and a cardiology nurse may be floated to a medicine unit, or a neurology nurse might be floated to a surgical unit. Now we know that these nurses are putting themselves at risk and they are not educated or don't have the specialty training to take care of these patients. By mandating this ratio in this bill, this can help prevent any errors and help protect that nurse's license. Why is this bill so important to healthcare? My thesis statement: nurse-to-patient ratios in hospitals should be mandated because it would contribute to job satisfaction, positive patient outcomes, and it would decrease the likelihood of adverse patient events. This bill is vital to making a significant impact in healthcare if passed into law. The key is to have nurses at the bedside using their voice to make a difference and advocating for their patients in order to provide exceptional care. By having less patients to care for, the nurses can form relationships with their patients and their families and sit and actually talk to them about their goals, their concerns, and get to know them personally. This is a great opportunity to see what motivates them. More time with our patients can help us focus on teaching and empowering patients and families on health initiatives. And then they can take that back to their communities. The extra time that we would have to spend with our patients is imperative to using our voice to start to make a difference at the bedside, and in turn, it would make a difference in the community. Positive implications for healthcare, according to Shin, Park, and Bay. Positive impact on job satisfaction, improved patient outcomes, and decreasing the likelihood of adverse patient events. Nurse-to-patient ratios have a significant impact on patient care and satisfaction. Patients are now more acute and more demanding than ever before. They need the nurse's attention, knowledge, and experience in critical thinking to be able to form relationships with patients and their families in order to provide safe and exceptional care. According to Shin, Park, and Bay, when nurses have too many patients to care for, they face job dissatisfaction, burnout, and often feel overwhelmed. These nurses tend to leave the bedside very quickly. Improving our nurse-to-patient ratios is imperative to also improving our patient outcomes and decreasing the likelihood of adverse events. It is vital to the success of the nursing profession. If nurses have too many patients to care for, they simply cannot ensure positive outcomes, and their ability to decrease adverse events is limited. For example, if a nurse has 8 patients overnight, she cannot ensure hourly rounding, Q2-hour turns, nor can she ensure that the PCA that just helped her patient to the bathroom has turned the bed alarm back on for safety. Evidence suggests improving staffing ratios is an important investment into what patients and nurses perceive as better care. Financial considerations. According to Paulson, change comes at a price, would add to the overall cost in the healthcare system, could initially cost the hospital millions of dollars. Hospitals would have to hire more nurses to mandate the nurse-to-patient ratios. This initially can be very costly. Hiring more nurses is a lengthy and time-consuming process, as most of us know. The hiring and orienting process costs money and is a tedious task. In order to hire more nurses, hospitals would also have to consider alternative means of convincing nurses to stay at the bedside, whether it's an additional monetary compensation every pay period or different initiatives to have nurses stay at the bedside. These are examples that would add to the overall cost in the healthcare system. In addition, it would initially cost the hospital millions of dollars to hire and retain nurses and be able to mandate safe nurse-to-patient ratios. However, ultimately, it would be cost-effective when preventing adverse patient events. The financial impact. Under the Affordable Care Act, Centers of Medicaid Services will withhold payments to hospitals if quality care targets aren't met. A patient with a fall and has an injury could cost over $14,000 on average. And a single central line associated bloodstream infection, which we call eclampsia, can cost over $45,000. Managing the safety and quality of patient care is paramount, and failure to do so is expensive to the patients and the organization. While initially it may be costly to an organization to hire and retain more nurses, it will be cost effective and we would be able to reduce the amount of money spent on adverse patient events. Under the Affordable Care Act, Medicaid will withhold payments to hospitals if quality targets are not met, and if a patient falls and sustains injury, tests are ordered and the length of stay is increased. An increased length of stay ultimately costs the hospital and the patient more for services provided. Another example of an added financial burden is if a patient develops a central line associated bloodstream infection. It could also cost the hospital around $45,000. Conclusion. Inadequate nurse-to-patient staffing ratios affect nurses, patients, and their families, as well as hospitals in which nurses are employed. High nurse-to-patient ratios are directly responsible for nurse job-related burnout and job dissatisfaction. Hospitals should invest in mandated nurse-to-patient ratios, which would decrease the number of nurses leaving the bedside, improve patient outcomes, and decrease the number of adverse events in the hospitalized patient. Evidence shows a direct correlation between poor staffing ratios and poor patient outcomes. I believe it is of vital importance for hospitals to invest in more nurses at the bedside. Nurses need to use their voice and become involved in different ways to make positive changes. If this bill passes the Senate and the House and becomes a law, it will maintain a stable workforce and keep our patients safe and free from harm. Thank you so much. That concludes my PowerPoint presentation. I hope everyone enjoyed it. Thank you.